Our platform provides, we call it the Koi Smart app, which is actually the knowledge optimized intelligence app. And that one not just fully automates the patient physician encounters, but it also takes care of documentation for coding. It saves almost 70%. That's a huge time that we're talking about. Physicians' time where it's put in grunt work.
Lalitha, thanks for joining the podcast today. Excited to speak to you and spotlight your work at Hikigai. First off, you have a unique background as a registered dietitian, a health coach, and now an entrepreneur. Can you share your journey and what ultimately led you to found Hikigai?
For sure, Bert. Of course. It's all about how the entire career has centered around helping people to live well and to live healthier and more meaningful lives. And I started out, with health coaching and being a registered dietitian and doing nutritional counseling. And that really kind of the experience showed me it's not just the patients who actually, tried hard enough to kind of cope with the healthcare system, but it's also the healthcare professionals who are equally burdened with a lot of the administrative burden that goes around, besides the fact that they also have to be clinically very, savvy and very sound. And that, I think this was during right around the pandemic that moved me into the entrepreneurial skills that I take over now. I definitely felt that wellness technology is going to be something that you need to cash in. And that was the right time when, Hikigai was almost like the desired bridge that would make me, combine both worlds of the wellness world and also utilizing that through technology and wellness. And that's what's led to, the fruition of Hikigai, what we have today. And looking forward to bringing healthcare to be more human through Hikigai. That's the whole purpose of it.
I love that. Yeah, there's not a lot of like CEO founders like yourself that have that sort of background of like being a dietitian, a health coach, like, where that's a very like human part of healthcare, that's important. And I'm sure you're using that, the tools and solutions you're building at Hikigai, which I actually want to ask you about that. Like when we last spoke, you were saying like you're currently focused on supporting different practices, not just in your home state of Michigan, but you guys are expanding even outside of Michigan. What challenges did you see in providers' workflows that made you want to build at Hikigai? And I think you have an AI scribe, right? So yeah, what did you see in provider workflows that kind of prompted that, build out of your guys' platform and your AI scribe?
Well, Bert, the first thing I'd like to kind of emphasize here is we are an AI enabled healthcare platform, and we go over and beyond just the AI scribe. So having said that, when we begin working closely with independent practices, we quickly saw that, the biggest grunt is, or the biggest burnout that happens is with documentation. But that's just one part of the tip of the iceberg, I should say. Providers have been spending, oodles of hours in charting, and they've been buried in complex billing workflows. And not just, that, they're also involved with a lot of the non-patient compliances or communications that happens. Needless to say, the siloed data that's available to them, and also fragmented EHR on a day-to-day basis. There is a huge burden of documentation and a lot of, the clinical aspects that needs to be taken into consideration too. That really led us to the ideation of bringing the AI scribe. But like I said, that AI scribe is just a nugget of the entire platform that we're offering today. Practices didn't need, just another tool. They need somebody who's a true operating partner for them. And that's precisely what you will see of Hikigai as a friend or an ally of practices that really want to show that they're able to automate a lot of the work that happens behind the screen, where much of the patient physician interaction is really what's focused on. Physicians were trained and they've gone through this entire course of period that they've been training to become doctors and specialty doctors, not to be buried in documentation and not to be buried in, the EHR work. They need to be involved with actually doing patient care. And that's our platform not just provides we call it the Koi Smart app, which is actually the knowledge optimized intelligence app. And that one not just fully automates the patient physician encounters, but it also takes care of documentation for coding. It saves almost 70%. That's a huge time that we're talking about, physicians' time where it's put in grunt work. And then it also unlocks a lot of the time that allows the connection for the patients and leading them to better care and more empathetic interactions. And lastly, I would like to kind of stress on this point that the reason why I would say we're not just an AI scribe company, we're beyond that, is on top of the AI scribe, we also have other layered add-ons or powerful add-ons like claim management, MEPS compliance, and we also have the value-based care optimization, which helps maximize the incentives and it drives real increases in ROIs, which is one of the most important things that you require in a practice.
Right, right. Spot on. So it sounds like you guys have really worked hand in hand with these practices to figure out like what are the areas that they need the most support on when it comes to documentation and charting. They spend so many hours already doing it. So like AI scribe is one of them, but AI voice appointment scheduling. We talked about claims that when you and I previously spoke. So there's a lot of areas that it sounds like you guys are helping them out with your AI platform,
Just the one last thing which we're very excited about is also the fact that we have an AI powered telephonic scheduling assistant. One of the things that was specifically asked by one of the physicians, where we're not kind of making jobs go obsolete, but we're making it optimized more, where the manpower can be used for more intellectual purposes, and the front office task that needs to be dealt with on a regular basis, where the scheduling happens and you can be notified in advance to kind of schedule the physician's time and his quality time spent with the patients. That's also AI powered. So this is like very exciting for us to have this additional feature that we've just come out with on the
Yeah.
demand of one of our physicians.
Very cool. Very cool. I know like AI is like all the buzz in the market right now. So, and you guys have like a pretty extensive library, it sounds like, of features of things you've built with AI. If like a practice wants to like build something new with AI, are you guys able to do that for them? You have the infrastructure and tools to build with them?
Yeah, so Hikigai today is truly an end-to-end partner in clinical and operational efficiency. So it'll take care of the whole 9 yards, if I may say so.
Yeah.
And what we have today with Hikigai is, even though we're focusing primarily on primary care practices, which are in private care, we are looking to extend that over and beyond. So yes, definitely, the platform that you can count on in terms of taking care of the whole process of the entire life cycle that happens between the physician and the doctor, or the physician and the patient.
Let's talk a little bit about that expansion because I'm interested. Like, how does Hikigai today help? I know you said primary care, that's a big focus for you. How are you guys helping those primary care practices today? And how are you guys thinking about expanding into like specialty areas like nephrology, gastro, endocrinology? Talk to me a little bit about that because I think it's pretty fascinating.
Let me put it in a nutshell. Hikigai is an extension of a practice team. We're kind of joining hands with them. We want to provide the AI powered clinical documentation, coding support to maximize reimbursement, make all the tasks automated to help them with the entire operation and run more smoothly. But besides that, it's also designed to feel intuitive and very natural. We want to be very seamless in how we kind of join hands with the practices, where we are able to provide the entire day's operation to become very seamless and effective. And in terms of how we're able to integrate with specialty practices, that's really the next focus, where we're focusing on nephrology, endocrinology, gastroenterology, and we're customizing our platform to fit their specific clinic and billing needs. So that's one of the most important things, because a lot of these practices, especially when you're talking specialty needs, the coding and the procedures that they do are all going to be slightly different from a PCP's office. Now, specialists do face many of the same pressure that the PCPs do, or the private care practitioners in internal medicine do, but within there is more complexity, and that's really where we're excited about kind of bringing that to make it more seamless and more effective and help them lighten their load.
Very cool. if I like learn one thing out of our conversation right now is that this AI platform you have and these AI features you build, like you call it, it doesn't like replace jobs of humans. It optimizes it and it plugs into their systems that they're currently using. Because I think that's like the big fear with like for those that are still fearful of AI, right? That haven't turned the corner on it. It's like AI is coming to take my job or replace my system, and it's like it sounds like that's not the case. You know, it's meant to really
No, definitely
complement.
not so. It's just going to be a very important phase of change, a leapfrogged phase of change where you're going to provide more physicians to be able to see more patients. Let's get real and understand that in the healthcare system today, we still have a lack of physicians in the United States, and we are not in proportion with the number of people who are sick. So if we are able to provide these physicians, whether it's specialists or whether it's PCPs, if we are able to have one physician take care of, instead of taking care of 50 patients, if he or she is able to take care of 200 patients with the aid of AI, I think we're only helping the system versus demoralizing that whole profession.
That's a quote right there on the power of AI for healthcare.
Yes.
Now, what do you think? Like I'm bought into the whole like AI in healthcare like revolution right now. You know, what tends to hold these like independent PCPs, the specialty practices back from adopting these AI driven solutions like the ones you guys have built at Hikigai?
I'm so glad that you brought this up because we've done some extensive market research, and we're talking about not just talking about the United States, but since we also have, and the founders are well rooted with the Asian Indian descent, we are focusing on looking at our expanding our market in India too. And in all of these places, honestly, Bert, the combination of skepticism and fatigue is really what is the boiling point. See, many practices have tried technology solutions that's been promised to them, that's been promised to the world, but it's just ended up in fiasco and creating more work where you see these doctors are burnt out and they're actually clicking, dashboards after dashboards where they should be providing care to the patients. And there's also real concerns, needless to say, about data privacy, hidden costs, disruption to their workflow. One of the biggest concern was how are we going to be seamlessly integrating with the current EHR system? That is one of the important questions without breaking into their entire workflow, because that kind of puts them off too. So these are some of the hurdles that we've definitely kind of understood, and we've done enough research. And at Hikigai, we are focused on building the trust first. That's very
Yeah.
important. We offer high touch onboarding experience, and we're fully transparent on how we're able to build that technology and how that works for each practice. We've also designed everything to fit into a provider's existing workflow, which is one of the most important things. It's just as simple as you have your own little room and you don't want things to be disrupted around you, because then you want to go find each thing.
Right.
So if you're able to maintain that workflow for them and not kind of disrupt that a whole lot, then you're definitely talking about, the change is very natural and very holistic at that point. So the at the end of the day, if the adoption comes down simply trusting the system and simply working with us in terms of how we are able to build the trust, make it very organic for the practice. That's something we're taking very seriously with Hikigai, to see that we, kind of get rid of or drift away the whole fact of skepticism and fatigue, which is one of the main concerns for not adopting.
Yeah, that's like the key is like not creating more work for these providers, like
Precisely.
at the end of the day, they spend majority of their time when they're in the clinic, even with the patient, documenting and charting in EHRs like Epic, Athena Health, eClinical Works, so it's like the key is like how can you integrate your AI solutions with those EHRs so it's the lowest lift possible for them,
Yep.
it's like
Yep.
it's
Yep.
like think about the advent of like ChatGPT, how easy I made it for everyone. That's like the new Google for everyone, and it's like
Exactly.
the
Exactly.
providers want a similar experience with where they spend their time, which is the EHR or their charting tool or solution that they're using.
So we're in line with a lot of the EHR systems already, Epic, Cerna, Athena, and like you said, many others. So we're already in that place where we've integrated with them. So then it's going to be the operation of us getting into a private practice is going to be a lot more easier for them.
Out of curiosity, like what does the time look like from when, a practice raises their hand, like they want to build with you, to when they get an AI feature or solution running and operational?
Excellent. That's an excellent question. Thank you so much for bringing that up. I would say if you're able to do a POC with a practice, we're talking about maybe about a week's time where we're able to integrate with them, get into the system, and we all have the paperwork and documentation ready. In about 3 months, we will be able to, because especially when we're talking about the whole 9 yard, where you're talking about claims and billing, we need a little more time than just about a week's time. Once we are in place with them, there we are an extension of the team, we're able to do the entire process maybe in about 3 months time. We'll be able to show them the difference.
That's definitely a reasonable time frame, yeah. And like
Yep.
it makes sense with the whole 9 yards being with claims and billing, because that's often like found either in downstream systems or applications, or they're a practice and they have someone manage billing for them.
Exactly. The outsourcing, yeah, the outsourcing kind of also, puts the entire practice in the dark sometimes when they're rejected for particular claims or they're not accepted for particular claims. This is where a platform like Hikigai will be very effective, where it's all one-stop shop.
And we've spoken about it. You've like worked with tons of practices in your home state of Michigan. You're speaking to other practices in other states. Like, what's the one AI feature or solution that you have in house that has most excited you, or that you're most excited about building?
Well, like I told you, the CDSS system is definitely one. The fact that we're going to the RCM, also kind of having captured that, is a very important factor. And now the telephonic scheduling system. And needless to say, we're also looking at, this is in the forthcoming versions that we're bringing, that we're actually looking to build, a more larger language model for many of the other demographics, more internationally too, which would give us more data. So currently in the United States, I would say the biggest exciting factors is having the AI integration, or the platform being integrated with the EHR systems,
Right.
and also having the CDSs in place, and needless to say, the RCM in place also.
Yeah. Right on. And for the viewers that aren't familiar with the concept of CDS system, can you break that down for us really quick?
Sure. Yeah, absolutely. This is basically talking about the entire diagnostic factors. And here too, we're not going to be, we're only empowering the doctors to be the final say, or the physicians to be the final say here, where we give them choices of what the diagnosis would be. And the diagnosis, in many times, can be misdiagnosed or misdiagnosed. These are two different words that I would like to specify one more time, where it is a misdiagnosis or a missed diagnosis, just because there are a lot of factors that cannot come into the forefront for the doctor. This could be a environmental condition that the patient has recently witnessed that's not come to the doctor's notice, a recent episode that has happened in his life or her life that has not come into his attention. It could be a nutritional factor, it could be exercise factor, all of these which actually truly needs to be taken into consideration when we are bringing that diagnosis into the forefront. That's really what the CDSS system, support system, will be enabling through the AI powered platform, where it's not just the information that's available in the EHR, it's over and beyond that also, where it takes into the 360-degree view of the entire patient, basically creating a digital twin of the patient for the doctor.
I love that. That's super powerful. I mean, right? Because there's a piece of AI in the market around time saving, and hey, it's a low lift because it integrates with EHRs. But what you're describing is there could be an actual potential impact on outcomes, with misdiagnosis and misdiagnosis.
Correct.
So that's very powerful that you guys are building that, and yeah, I love that. So finally, for providers, like practice leaders that are listening and thinking, man, this is the kind of partner we need to build AI into our practice.
Mm-hmm.
How can they connect with you and your team online?
We would love to connect with all physicians and all healthcare professionals who really see the value with Hikigai. And you can connect with us at www.hikigai. Let me spell that for you. It is HIKIGAI hikigai.ai. That's www.hikigai.ai. And you can learn more about us. Also, we can schedule a demo for you, and we can also have a conversation with our team. And we also now have what's called a basic koi engine, where you could go to koi.hikigai.chat. That's koi.hikigai.chat for a free, a trial where you'll be able to kind of get a feeler for what we were talking about, the diagnosis and everything. And then, of course, needless to say, you can connect with us on LinkedIn at hikigai.inc. And if you're even more, curious about it, I would love to also personally connect as the CEO of Hikigai to see how AI can fit in your space or your practice. And we'd be happy to reach out and do our best.
That's you read my mind. I was about to ask you about that because other clinicians like speaking to fellow clinicians, and you've been in their shoes. You've worked hand in hand with these practices with patients, and I'm sure that experience has informed the build of something like koi.hikigai.chat. And I'm on the website right now, and I love it. I'm gonna have to play with this
Thank you so much.
after the call. Yeah,
Yeah,
this is
yeah.
great.
Credit goes to our entire engineering team and a very, very sharp CTO that we have who's done the big brunt of work there.
Yeah,
Yes,
and that could give practices a feel, like you're saying, a feeler for diagnosis. Like, how does it actually
absolutely.
impact? How does AI impact this? Like,
Yes.
that's your value, right?
Yes, yes.
Up
And
front.
I just want to share a little story or an incident here where we actually was talking to a physician, and for the longest time he was treating a female patient who was actually frequenting to go to Connecticut, and she was diagnosed with an unknown condition which they were kind of predicting it to be an autoimmune disorder, but then they also found out that she was frequenting to go to Connecticut, but then when we added that environmental information, that's when they were able to figure out that she did go a lot to hiking and stuff, and she was found to have Lyme disease.
Wow.
So the COI was able to pick that on and actually diagnose that as one of the conditions that could be good prediction with the predictive analysis. So this kind of definitely excited us. That's just one episode that we're talking about, but there are a few others that we definitely would be able to kind of jot out for people who need to know how this works.
Yeah, that's a powerful story. I mean, literally talk about a real life example of
Yes,
a
yes,
patient where something like having this koi system helped identify these environmental triggers. Like, hey, this patient actually has been going hiking a lot. Check to see
correct.
if there's something else going on, Lyme disease, which that's a powerful story. Yeah.
Yep, yep, definitely,
Yeah.
definitely.
Well, Lalitha, it was a pleasure speaking to you today, having you on the podcast. I love what you guys are building. We'll definitely drop those links in the description below and in the comments below so that people can check out the work you guys are doing, including the koi.hikigai.chat. And yeah, it was a pleasure speaking to you and having you on today's podcast. Thanks for
Thank
coming along.
you. Thank you so much, Bert. Once again, happy birthday to you, and
Thank you.
it's a pleasure to be being featured in HealthTech2Care, and I think it was wonderful to also converse with you. Indeed, you have been a great host in kind of
Yeah,
nudging us to kind of give us the right pointers, and that really makes a difference. So, thank you very much for the opportunity.
100%. And my pleasure, back to you. And 2, 3 years from now, we're going to look back at this and be amazed at how much AI has advanced, by then. And like the use
Absolutely,
cases we were talking about now, we're going to be like, man, like that, a lot's changed since then. It's like we were solving simple things, and in the future, we're going to be looking at entire systems and
yes,
like the whole patient journey is going to be involved with AI. So I'm
correct,
excited for that. Yeah.
correct. Yep. Thank you so much. Yes,
Yeah.
thank you.
Thank you.